But really, what is a screening mammogram and should I be getting one? A screening test is any test that detects disease before the signs and symptoms for the disease appear. The goal of breast cancer screening is early detection, that is, detecting breast cancer before you begin to see signs such as a lump in the breast. Early detection and aggressive treatment are the two most important strategies to prevent death from breast cancer. The size and spread of the cancer are two most important factors in predicting outlook of the disease. Breast cancers found during early detection are usually smaller in size and confined to the breast. Mammograms are the main screening test used in the detection of breast cancer, and they're essentially low-dose X-rays. Mammograms can detect breast cancer years before any physical signs of the cancer develop, and usually during an early stage such that aggressive treatments such as chemotherapy or complete breast removal, that is mastectomy, may not be needed. Of course, mammograms are not perfect and they can miss some cancers. If something is found on a mammogram, you will most likely require additional testing such as a second mammogram or breast ultrasound. There are two types of mammograms, 2D mammograms and 3D mammograms. Research suggests that 3D mammograms can detect more cancers, and they're also useful in women that have dense breasts. 3D mammograms may also reduce the chances that you have to come back for follow-up testing in case something is detected. 3D mammograms, however, are more expensive than 2D mammograms, and sometimes insurance may not cover the additional cost. Currently, the American Cancer Society recommends that you get either 2D or 3D mammograms for routine screening. It's a good idea to discuss this with your doctor to figure out what the best option is for you. For screening purposes, a woman at average risk is defined as someone that does not have a personal history of breast cancer, does not have a family history of breast cancer, does not have the genetic mutations that are associated with an increased risk for breast cancer, such as the BRCA gene, and women that haven't had any chest radiotherapy before the age of 30 years. For these women that are at average risk, the American Cancer Society recommends that if you are between 40 to 44 years of age, you can choose to get a mammogram every year. If you are between 45 to 54 years of age, you must get a mammogram every year. And if you are 55 years and older, you can either switch to getting a mammogram every other year or continue getting a mammogram every year. For women that are considered high risk for breast cancer, that is, women that have more than a 25 to 30% lifetime risk of developing breast cancer, which is calculated based on a number of factors, including your family history, for such women, you should get a breast MRI in addition to a mammogram every year, starting at 30 years of age. While research shows that monthly breast self-exams don't help in the early detection of breast cancer, it is important that you know how your breasts look and feel normally. That way, if you notice any changes, you can reach out to your doctor right away for further evaluation.